Do you have trouble getting or keeping an erection? Do you feel like your sexual performance is not as good as it used to be? Do you want to know how to improve your erectile dysfunction with natural remedies? If you answered yes to any of these questions, then this video is for you. In this video, I'm going to reveal 4 traditional herbs that have been used for centuries to treat erectile dysfunction and enhance sexual function. I am also going to explain what ED is and how it affects your sexual health. These herbs are safe, effective, and easy to find. They can help you increase your blood flow, boost your testosterone levels, and improve your mood and energy. You will be amazed by how these herbs can transform your sexual performance and pleasure. Hi everyone, welcome back to Dr. J. Lim's Holistic Health Corner. I'm Dr. J. Lim, an academic doctor from the University of Cambridge. I'm passionate about natural health and wellness, and I love to share my knowledge with the latest scientific research evidence with you. Now let's get started. So, what is erectile dysfunction or ED? ED is the inability to get or keep an erection firm enough for sexual intercourse. The erection is a complex process that involves the coordination of the brain, nerves, hormones, blood vessels, and muscles. When any of these factors are disrupted or impaired, it can affect your ability to get and maintain an erection. ED is a very common condition that affects many men, especially as they get older. It is estimated that about 40% of men in their 40s and up to 70% of men in their 70s have some degree of ED. The main causes of ED can be divided into physical, psychological, and lifestyle factors. Some of the physical causes include heart disease, diabetes, high blood pressure, high cholesterol, obesity, smoking, alcohol abuse, prostate problems, nerve damage, hormonal problems, or anatomical problems. Some of the psychological causes include stress, anxiety, depression, low self-esteem, relationship issues, or other mental health problems. Some of the lifestyle factors include lack of exercise, poor diet, insufficient sleep, or exposure to environmental toxins. ED can have a negative impact on your sexual performance, confidence, and satisfaction. It can also affect your partner and your relationship. That's why it's important to see your doctor if you have any sexual symptoms that bother you or affect your quality of life. Your doctor can do some tests to find out the cause of your ED and recommend the best treatment option for you. There are many treatments available for ED, such as oral medications, injections, vacuum devices, implants, or surgery. However, some of these treatments may have side effects, risks, or limitations. But what if you want to improve your ED with natural remedies? Well, there are some herbs that have been used for centuries to treat ED and enhance sexual function. These herbs are safe, effective, and easy to find. They can help you increase your blood flow, relax your muscles, boost your testosterone levels, and balance your hormones. Let me tell you what they are and how they can help. The first herb I want to talk about is Chlorophytum Borivilianum, also known as Saft Musli in India. This plant has been used for centuries in traditional Indian medicine to enhance male sexual performance, treat diabetes, and reduce inflammation. But does it really work? Well, according to scientific studies, it does. Maharaj et al. Showed that Chlorophytum Borivilianum can protect your sperm quality and testicular function from oxidative stress, which is a condition where there is an imbalance between the production and removal of harmful molecules that can damage your cells and tissues. Oxidative stress can cause erectile dysfunction, infertility, and other sexual problems. Chlorophytum Borivilianum can prevent oxidative stress by increasing the levels of natural antioxidants in your testes and sperm. These antioxidants are substances that can neutralize the harmful molecules and protect your cells from damage. To use Chlorophytum Borivilianum for sexual function, you can drink a cup of its root extract every day. You can either buy the extract online or make it yourself by boiling some dried roots in water for about 15 minutes. You can also take it as a supplement in capsule or tablet form. The recommended dosage is 50 mg per kilogram body weight per day for 7 days before engaging in sexual activity. Hey everyone, I hope you're enjoying this video so far. If you find this type of educational content useful, it would really help the channel if you press the subscribe button and turn on the notifications bell. By doing so, you'll be the first to know when I upload new videos like this one. You'll also be supporting me and helping me grow this channel, which means a lot to me. If you have any questions or comments, please leave them below and I will try to answer them as soon as possible. If you like this video, please give it a thumbs up and share it with your friends and family as well. Thank you so much for your support. Now, let's get back to the video. The second herb I want to talk about is ginseng, a root that has been used for thousands of years in traditional Chinese medicine. Ginseng is known for its benefits on the brain, such as boosting energy, immunity, and mental performance. But ginseng can also improve your sexual performance by increasing your blood flow and nitric oxide levels in your blood vessels. Nitric oxide is a molecule that relaxes the blood vessels and allows more blood to flow to the penis during sexual stimulation. This results in a stronger and longer-lasting erection. But does ginseng really work for erectile dysfunction? Well, according to a recent systematic review by Li et al., ginseng may have a small effect on improving erectile function compared to placebo, based on a validated instrument called the Erectile Function Domain of the International Index of Erectile Function. The review also found that ginseng may improve men's self-reported ability to have intercourse compared to placebo, based on the number of men who reported successful intercourse. However, ginseng may have little to no effect on adverse events or satisfaction with intercourse compared to placebo. The most common adverse events reported were headache, nausea, and diarrhea. To use ginseng for erectile dysfunction, you can take between 600 mg to 3,000 mg of ginseng per day, divided into 2 or 3 doses. You can take ginseng in capsule, tablet, liquid extract, or tea form. You can find different types of ginseng online or in health stores, such as red ginseng, Korean ginseng, and American ginseng. They may have different effects and dosages. The third herb I want to talk about is saffron, a spice that is derived from the flower of Crocus sativus. Saffron is one of the most expensive spices in the world, and it has been used for centuries in traditional medicine for various purposes, such as enhancing mood, memory, digestion, and vision. But saffron can also help you with your sexual problems by improving your sexual function and satisfaction. But does saffron really work for sexual dysfunction? Well, according to a recent systematic review and meta-analysis by Ranjbar et al., saffron can improve sexual dysfunction and its subscales compared to placebo. This means that saffron can help you with arousal, lubrication, orgasm, satisfaction, and pain during sex. The review included 5 studies that compared saffron to placebo in 173 participants with sexual dysfunction. The studies used different doses and durations of saffron supplementation, ranging from 15 to 200 mg per day and from 4 to 12 weeks. The review found that saffron had a statistically significant positive effect on sexual dysfunction and its subscales compared to placebo, based on the pooled analysis of the standardized mean differences. The effect sizes were moderate to large, which means that saffron can have a noticeable and meaningful impact on your sexual function and performance. The review also found that saffron was well tolerated and had no serious adverse events compared to placebo. The most common adverse events reported were headache, nausea, and diarrhea. However, these were mild and transient, and they did not affect the compliance or dropout rates of the participants. So how can you use saffron for erectile dysfunction? Well, there is no standard dose or duration of saffron supplementation for this purpose. However, based on the studies included in the review, you can try taking between 15 to 200 mg of saffron per day for at least 4 weeks. You can take saffron in capsule form or as a powder that you can add to your food or drinks. Saffron may interact with some medications or supplements that you are taking or may have some contraindications or precautions for your specific health situation. For example, saffron may lower your blood pressure or blood sugar levels, which can be beneficial for some people. but harmful for others. Saffron may also have some anticoagulant effects, which can increase the risk of bleeding or bruising. Saffron may also affect your mood or mental state, which can be positive or negative depending on your individual response. Ginkgo biloba is a plant that can improve your brain and sexual function. It can increase your blood flow and nitric oxide levels, which can help you get and keep an erection. It can also balance your hormones and reduce your stress, which can boost your libido and pleasure. According to a recent systematic review by Mashhadi et al., Ginkgo biloba can improve sexual function in postmenopausal women, but not in men and women who have sexual dysfunction due to antidepressant use. The review also found that Ginkgo biloba had fewer side effects than sildenafil, a common medication for erectile dysfunction, in men with ED. The review suggested that Ginkgo biloba may work by increasing the production of nitric oxide, inhibiting the enzyme that breaks down the substance that mediates the erection process, and modulating the levels of neurotransmitters that are involved in sexual motivation and pleasure. You can take 120 to 240 milligrams of Ginkgo biloba per day in capsules, tablets, liquid extracts, or tea form. Ginkgo biloba may interact with some drugs, such as blood thinners, antidepressants, and anticonvulsants. So these are the 4 herbs that can help you with erectile dysfunction and other aspects of sexual function. They have different benefits and mechanisms of action, but they all work together to improve your blood circulation, nitric oxide levels, hormonal balance, antioxidant status, mood, and pleasure. They are also safe and well tolerated for most people, but you should always consult your doctor before taking any supplements, especially if you have any medical conditions or are taking any medications. I hope you enjoyed this video and learned something new. Thank you so much for watching, and don't forget to check out my previous video here, where I reveal the 4 foods that you should avoid if you have an enlarged prostate. These foods can make your condition worse and increase your risk of complications. So watch that video and learn how to protect your prostate from these harmful foods. And I'll see you in the next video. Bye for now.